Hello, class. This is Randy Gaines. Trying to do this video. I've done it several times. Um, Anywho, uh, these are the responses to our questions for our Community Health Nursing Caring for the Public Health third edition. I will read the question, define what the terms are, and then I will tell you what I think that means to us in our practice. So the first question is, and it is compare and contrast the concepts of community health, population focused care, and acute care. So I define them. Population focused care work with the entire public and populations with the emphasis on prevention, not in an official public health agency, to improve the health of populations. So, what does that mean to me? That means that that branch of the of work being done is for the population as a whole. So, not an individual community, not individual people, but everybody. Whether they're in the same community or not, stuff that actually affects the whole. So our immunizations affect the whole. Um, any kind of outbreaks or something affect the whole. So I believe it means that if epidemiology is in anywhere in play, any of the three P's come into play, that's where population is taken over at. Community health, a systematic process of delivering nursing care to improve the health of entire community. So, in the community, these are the groups of people that have something in common. So, black people, white people, Hispanic people, um, the alphabet uh, of several different organizations that we have now. There's so many I can hardly keep up these days. Um, so, all of those communities. Now, in the community setting, we also have to go to them. So the nurse, us, um, will actually go to a place, a church, an outreach center, a gym, wherever we're going to, like their actual home, um, any of the different facilities. We go to the patients, and they have a lot of control over, how much information they're going to give us. Um, our, we're on their turf, so to speak. So we're coming to them, and we are trying to convince them that, hey, something's going on within this community. We're here to help. We got to try to get them to accept us, and we got to do a whole lot of work depending on the community that we're attempting to serve. So it's kind of one of those things where you actually have to be a pretty good people person, and you got to get people to trust you so they open up. So our last one is the acute care setting, which I believe most of us actually work in, if I remember correctly, from our interviews, from our previous interviews and other classes. I think it's a couple people that do hospice, but I think for the most part we're all um, in the hospital. So when something happens acutely, the patients come to us in the hospital. Um, so they are then on our turf. They are seeking out our services, um, and a lot of times they don't want to be there, but they have to be there to get the service. And we drive the care. We, the collaborative team, the doctors, nurses, phlebotomists, respiratory, everybody that might poke, prod, scan, manipulate, you name it, we do it. And that's what they have to deal with in the hospital. They become patient Gaines in room 36 with appendicitis, and then they take on everything that comes with that diagnosis. So the lab work, the scans, the blood pressures, like everything. You're not getting visitors just all times of night. I mean, it depends on which floor you're on. Some people have visitation. Some people can't have overnight. Some people stay in areas where they have um, they have to share rooms, so there is no visitation. Once that visitation is up, you go home. You're not staying overnight, or you're restricted, like in ICUs. I believe, depending on the ICU, you can only have one visitor at a time, maybe two, and there are a whole lot of parameters that go along with that. That's not my area, so I tend to leave the ICU to themselves. So I've already touched on some of the differences, um, but all three of them are part of the care, or the continu- continuum of care that we're supposed to be addressing in nursing. Discuss how epidemiology impacts the practice of public health. Well, I'll define it first. Epidemiology is the science that provides community and public health with the framework for addressing the primary, secondary, and tertiary health needs for a population and directs community health nursing practice. That's on page 24 of the text. Um, so then I'll actually define the three P's as, or no, the that's not the three P's, that's something else. That is, oh, I'm sorry, the three levels of prevention. So that is the primary, secondary, and tertiary. Primary is health measures that focus on prevention of health problems before they occur. The job is to catch it before. So mammograms, our wellness checks, all that stuff is the primary. So we are trying to prevent and a disease process at the beginning. Okay. So then you have secondary prevention, and that is health measures that begin with when pathology is involved and is directed at early detection through diagnosis and treatment. So now the something has happened. We know it's happening, and now we're in the midst of trying to fix whatever the issue is. This is my take on it. I'm not 100%, but I'm pretty sure that's what it is. And then you have your tertiary prevention, and that is health measures that are taken when illness, injury, or disability is irreversible. Interventions are focused on rehab. The goal of these measures is to restore the person to optimal level of health functioning. So what that means is something has gone wrong. This stroke, heart attack, pacemakers. So the person has had something happen, and now we have to get them back to, if we can't get back to baseline, we have to get them close to back to baseline, or a functional part that they find acceptable to deal with, which can be a long term process, and it can keep flipping back on itself. So they also refer to the epidemiological model or triangle. And what that means is that the disease starts with the host, or whatever starts with the host. So the host is the human body influenced by such variables as gender, age, race, and behavior. So then there's the agent, and that's a physical, chemical, or biological element that can cause or injure someone. Maybe tuberculosis, nicotine, that Juul thing that everybody's been smoking. That would probably go into that category right there. And the environment. The environment is perhaps the most complex component as we learn more about determinants. So environments hold more and more keys to explaining health risks. So what that means is it can be your physical environment. Is it cold, or am I in the mountains? Um, like it referred to political environments, poverty, racism, and other stressors that can influence your health. So if you're inner city and you're constantly worried about, you know, getting shot, getting attacked, the you know, not good housing, not really knowing where your food and checks and meals and stuff are coming from, that's a pretty good stressor. Um, so that would be a really bad part of your environment. Or say you're in the mountains and you don't have a lot of hospitals and a lot of meth going on in the mountains, just in case you didn't know, um, in rural places in Kentucky and Ohio, a couple other places. So it can get pretty bad pretty fast. So that was that. Three, what is the application of nursing agenda for healthcare reform? So what I took from that was in the 90s they tried to do healthcare reform and failed like they usually do. It's not something that we really, I don't think we'll ever get healthcare right. Um, but the National League of Nursing actually was able to get their agenda going forward, and it was the first document that this document was significant in terms of its expressing of nursing values and furthering an understanding of the profession itself. So, the National Nursing League came up with a document, and it basically told other people this is what nurses are going to do. This is how we plan to go forward with our practice, and what we will bring to you as the community and to the population, as opposed to us just kind of being the doctor's handmaiden, is what I took away from that. And that was from page 16. And explain in a video post the community as a partner model. So I actually attached a picture that you'll be able to see in my kind of where we cite everything at, this where the video is too, um, because I saw it, but I had to wrap my head around what it was meaning. So the community as a partner model was developed at the University of Texas, and a nurse by the name of Betty Newman um, came up with it. So it focuses on the community is as the core of a population, and then the community has these eight. You'll see the picture. So the the community is in the middle, and then it has these eight little like spokes, kind of if you envision a a wagon wheel or something. But you have all these little factors on the outside that are trying to that make up the issues that are ups well could be upsetting to the person in the middle or the community. So you have to address these things. Like you can't just address one thing. There's, I don't want to say tiers because it doesn't go like this. It's like each thing has its own important part on the wheel, and you can't just leave something out because you don't feel like dealing with it, because each part is an important reason as to why the community is being affected. And if you are unable to, are actually able to get address all of it, you potentially fix that problem, is what I took from that conversation. If I'm wrong, but that's what I took from it. So the core of any community is its people. Included in the core are the demographics of the population and their values, beliefs, and history. The core in turn affects it is affected by the eight interacting subsystems. Subsystems are physical environment, education, safety, transportation, politics, and government, and health and services, communications, economics, and recreation. So, community subsystems. If we can get everything like kind of doing like this, we can answer the question and actually fix a problem in our community. And then number five, discuss through video posts what you learn from your reading, the factors that impact the poor health outcomes we experience in the U.S. when we are technologically advanced compared to other developed countries. Whew, that's a lot. So, what I took from that is technology is not really technologically we have the advancements, but people don't have access to it. You have mountain people, you have rural people. Everybody doesn't have the same access to everything that somebody else might have, even in the other developed countries. I believe some of us are in the communications class, so we're kind of they kind of blend like this. So in the communications book, we're also talking about different places like Japan and where else? Japan and India and some other places, Russia, China. So we're talking about these other places, and though we are so technologically advanced, that is not helping everybody. It's helping people that are in cities, and then it's in certain cities. So what we have here in Charlotte may not be what's needed in, say, Philadelphia or Detroit. Like their trauma units are the big thing up there because unfortunately have a lot of shootings and traumas. So that stuff is bigger up there, whereas down in the South, we're kind of fat and out of shape. So a lot of ours is cardiovascular and diabetes management and cancers and stuff. We're not the healthiest people down south. Our food is good and the tea is sweet. I don't know what to tell you, but anywho, so what I learned was what I've always learned from you know our practice is that if if we don't find a way to make it accessible to everybody, it doesn't really matter that I can do this in Charlotte, but if they can't do it up in New York, or I have to find a way for my patient to get to New York for a treatment that's only treated at Children's Hospital in Philadelphia. Um, so we kind of have to do better, but nursing is in large kind of taking the responsibility. I mean, it's not just us, but it is a lot of us focused on how to fix some of these problems. So that is what I took from this reading. I guess we will be talking about it here shortly, or not. I think I tried to make this as short as I could, but I wanted to actually make sure I was answering the question. So I guess y'all will see me in like 2 seconds if I can get it to upload.